team, public health intelligence analyst team, about 10 to 12 people now. And yes, I'm going to talk to you about our cost of living dashboard, what it is, how we built it, and really about its purpose and its impact. I think we've heard a lot over the last couple of days, yesterday, about how people have built stuff, how they've linked data, and I really want to get into the impact that we've had with our cost of living dashboard. So to say it's a collaborative project, it's not just me that's built it, it's the whole Waterfall team, and it continues to be refined. So we first launched it about a year ago now, and it's something that is iterated on. There's no such thing as like the final version. It's something that I carry on refining on a weekly basis almost. So a little bit of context to start off. So as everyone knows, cost of living crisis has become more and more significant as time's gone on over the last year and a half. And so our team were asked, as part of our joint strategic needs assessment, or JSNA, to publish a cost of living profile. So that was a written report that was asked for by our councillors. And so the idea really was to pull together information that was relevant for the people of Suffolk, rather than just national data, what's actually relevant for our community and our people. So get this information, what it means for them. So this written report informed our poverty strategy and our action plan related to that. And we soon found, however, that this became outdated. As I'm sure everyone knows, the cost of living crisis has moved quite quickly. The data has changed very quickly with inflation, interest rates, and things like that. And so we needed a source of information, not only for ourselves, but also for our councillors, the public, and for the media, up-to-date information. And this is the approach we went for, was the dashboard. So just quickly, what we'll cover in the next 20 minutes or so, show off a little bit of our cost of living dashboard, an overview of the data sources that we've used, also talk a little bit about automation, how we've managed to reduce the manual input that we need to keep this going, which is something we were very aware of when we were building it. We don't want to make something that we'd spend a load of time trying to manage down the road. We want to make it the right touch as much as we could. Discuss how the dashboard is used locally, and also some examples, as I said, about how we've used it to drive action and impact. So some of the key aims of the dashboard really was a focal point for relevant data. I mentioned before about how we wanted to be relevant for the Suffolk population, and a key part of this is looking at small geographies. So rather than Suffolk as a whole, actually let's look at these really small areas. So if you're familiar with lower super output areas, middle lower super output areas, census geographies, and also our health geographies, things like INTs as well. And also to highlight inequalities, to support action and targeting of limited resources we have to address the cost of living crisis. When we have those geographies, small breakdowns, we can really start to look at those inequalities and look where we might want to use our resources. So a little bit about why we chose Power BI. I appreciate that a lot of people in the room will probably be familiar with Power BI, so I'll go over this as briefly as I can. Essentially for a low-code solution. We didn't need any advanced statistical capabilities in something like R or Stata. We really just needed to be able to get data in from various different sources and present it in a way that everyone could understand, everyone could use. We also have experience from using Power BI for COVID-19 reporting. As we had earlier with the national dashboard, it wasn't quite as fancy as that. We didn't have those numbers hitting our website, but we did win a national award for Corona Watch from the UK IT Awards for our Corona Watch suite of products. That was a public dashboard and an internal version, so the same dashboard all running from the same data sets. We know as well that our users are familiar with Microsoft products. I'm sure everyone is at this point, but it's quite easy to understand, it's easy to use, people are familiar with it, which is what is really important for us, especially when we're looking at councillors and members of the public. They don't have time to go through really extensive guides on how to use something, they just want to get see this information as soon as they can. We also have established information governance in place. So some of the data that's in the dashboard I'm going to show today is internal, hasn't been published before, but we have the IG in place for the COVID projects, from the project as well, to show it in these aggregated forms, which has been really useful and quite way ahead of some projects. We also use Power BI as it's enough to refresh. I'll talk about that a little bit later. Again, it's keeping that manual input as low as we can to keep the product online as much as we can. So in terms of features, I'm not a huge fan of those first completely placed words, but I'll do my best. So as I said before, place focused. Not everything, not all the data is available at small geographies, but where we can, we get it down to, let's say, things like LSOI. Sometimes it's only at the district above borough level, but that's unfortunately some of the restrictions we face. I mentioned before about automation. We've made good use of APIs, such as LG Inform, Stats Explore, Nomis, and the ONS's API as well. Again, I was building on experience earlier about the COVID dashboard, national dashboard, and the APIs they have. It's really collaborative. Again, it's not just our team, it's across the entire Suffolk system. We're bringing data in, we're bringing partners in, and the feedback of their data to the extent as well. So things like food banks, supplies, and data even about website usage, which the dashboard can bring in and show on. Self-service is quite important for us. We ended up to start the cost of living crisis with a lot of queries coming in, especially from councils. How is this affecting people in my area? What are the numbers and things like that? Being able to have a self-service tool doesn't eliminate all of those queries, but it does certainly help because you can, in the first instance, direct people to this tool. And it's live as well. As I mentioned, it's the data is updated. I think something like 5 or 6 times a day. People a refresh. Most of the time it works, which is nice. Sometimes it doesn't. But yeah, it is as live, I think, as we can. So I was originally planning to do a live demo. I didn't because they always go wrong. So instead, we'll just look at some screenshots and hopefully get a little bit of an idea and a bit of a taster. So this is data from the ONS on family expenditure. So on the left-hand side, the income deciles and the lower bound of people's weekly spend. And you can see the different colours across there are different quantities of services that people are spending money on. Just quickly to point out some of those features for users that we have. On every page, we have the box at the top or the side to explain what people are looking at. We found this really useful. Not always something that other dashboards have, and certainly some of our previous dashboards didn't have. So you end up having to explain to people. So we want to be really clear what people are looking at. And also saying, at the bottom there, about the data availability, it's public, it's something that's internal, it's source there, and also the dates as well. That's one of the questions we get asked so often. When is this last updated? And the future development is going to be, when is it next going to be updated? As much as we can. So yeah, on this particular one, I think it really shows the inequalities between those that are more well off and less well off, especially in the food and the housing and spending. Against sort of performance of our work. This one we're more proud of. So this is free school meal entitlement in Suffolk, and this is looking at NSOA levels in really small geographies. As I said, this isn't something that was published before, but we had permission from our children and people's colleagues when it's aggregated up, put the data in bands, 5% bands. So it aggregates up, and you can really see some inequalities there. You Ipswich, those of northeast Suffolk. So I think the Suffolk average for free school meal entitlement is around 21%. But then what you see somebody there is only 40%. That's the boundary we said some of those percentages are quite hard. And it really does show where we need to be prioritising some of our resources, perhaps. Cost of living support. You see what options there to show SLA level as well, depending on what our users are looking for. Here we're looking about universal credit claimants and the demographics of those claimants. This is really fascinating. I think the graph on the right hand side as well, those on gender, the difference between men and women in those claimants trends, I think is really interesting and is something that we're trying to work out why it might be the case. And the aging as well. You notice the filters at the top right, so you can look at that, I think, down to district borough level, to again get more of an idea of what's going on locally. And the last page I'll show is again some more internal data. So this is our local welfare assistance scheme, LWAS. On the left hand side, this is a huge peak in December 2020 of applications to that scheme. And how that's being consistently used after that as well as some more data that's again perhaps more useful to Suffolk County Council colleagues in terms of info link to the website and referrals to our warm home handling scheme. So hopefully that was useful as a guide of the kind of things that we've got in the report. A little bit now about how we built it. It's diagrams. Again, it's not a sophisticated pipeline that we saw earlier, but it's just a sort of diagram to show how we went about it. So those pink circles on the left hand side, they're all automated sources, which pleased to say most of the data sources are. There's APIs that I mentioned earlier. The blue one is also piggybacking off local data, so citizens' advice, Facebook meals, so which we're really pleased to be able to work with local colleagues to bring that data in. So their updates, and from our perspective as analysts, it means we're not asking for email data across. We just go straight into those for SharePoint spreadsheets and pull it in. We do have some manual updates. Not enough other rules anymore, someone else on our team does. But yes, we do have some manual work, so that is something to consider, I think. If you're looking at something like this yourselves, there will always be that kind of manual element to some things. Although we're always looking at trying to get around. I'm sure you're familiar with the rest of the process. So pull that up together in a Power BI data set, it's on a scheduled refresh, and then go straight to our report. The terminology of reports and dashboards is something that winds me up quite a bit. It's called a dashboard, it's technically a report, but that is what it is. So in terms of automation, a little bit more about the various techniques we use. A couple of examples over there. LGM Form Plus has a fantastic API, really easy to kind of go in, look at the data you want, pick the geographies that you want, and it spits out a URL for you to use, static URL to connect to. Similarly, for INS data we've used, just static web URLs where that's possible. Static Explorer, we had some assistance with from PG, local data engineering consultancy, just to get that all working. Similar kind of thing, getting an API tool working. And again, SharePoint as much as we can for our local data sources, just connecting directly into those files to publish that data. Just looking at our impacts, what we've been able to do, this is something that actually caught us a little bit off guard. So when we first asked to present a cost of living dashboard elsewhere before, we sort of did a bit of a survey just to understand what people had used the dashboard for. I think we were quite surprised just how much it had been used. I think it's that way sometimes we kind of go do our job and then that's kind of it, we move on to the next project, right? But sometimes we don't see that evaluation and actually what we used it for. And I think it spreads beyond what we might expect. So a couple of examples there. We had it was used for some specific data on the local welfare insurance scheme, and housing support. Third most visited page on Healthy Suffolk at the time of writing this, which we were quite pleased with. I can't remember the number of monthly visitors, but it was quite significant. It's sort of taken over from our coronavirus dashboard. It's now this cost of living dashboard. It's used as a live briefing tool for our VCSEs, Health and Wellbeing Board, and Collaborative Communities Board for planning and action on their front. It's also used to secure £1.5 million from Suffolk public sector leaders for something called a food network, and particularly free school meals and citizens' advice data, having it presented in that way that was perhaps more accessible than what it would have been otherwise was instrumental. And we've also got towards the public mental health funding bid for around citizens' advice for the funding for them. That's £150,000. Yes, it's what there and support citizens advice. And then I guess in terms of takeaways, the main one for me is that top one about bringing data together and the real power you can do from taking the national data and then supplementing it with what you've got locally. I think in our case, it's really helped identify those inequalities and things that you just don't get without combining both of those data. Collaboration, we're really lucky in the Suffolk system, I think, to have some fantastic partners that are willing to share data in usable formats without having to cause us too much work to get it into something like this dashboard. And it's absolutely worth asking both the data and sort of that soft intelligence as well sometimes that you don't often get. If you don't ask, you don't get, I suppose. There's also no need for coding experience. So our team aren't data scientists, we're all kind of analytical types. There's not a huge amount of experience, but there is experience across the system. So whether that's regionally, we did have some consultancy support for this project, but our colleagues at Suffolk County Council, Essex and Overboard on the floor, SODA colleagues, Suffolk Office for Data Analytics, people are doing the same kind of things and everyone can kind of feed in and help you out, and I think that's really important. Dashboards in general, probably worth the initial investment sometimes to reduce the kind of queries and ad hoc requests you get down the line. They're reusable, adapt them to what you need. Sometimes it is quite worrying when you look at the amount of work you need to put in to get something like this up and running, but in the long term, it is worth it to be able to deliver things down the line. And lastly, it's an iterative process. Again, as the guys mentioned earlier, the COVID dashboard, what you start with is usually a minimum viable product. Let's get something out there, see what people think about it, see how they use it, and kind of just take it from there and iterate it over time. So we have, like I said, I think it's published first about a year ago. I don't know what version we're on now, it's quite a lot. Adding pages and taking them and changing the way that we're displaying data, adding more information into those things. And I think that's the real power of dashboards and be able to iterate like that various stages. And I think that's just about all I've got. So thank you so much for listening.